Hello, sir. I'm
Nice
Aravind,
to see you.
MEDWIN Overseas Education.
My name is Georgi Medashvili. I'm head of the Office of International Relations at the University of Georgia, biggest international university in the country.
First of all, I need to know about University of Georgia in Georgia.
Well, the Georgia is the small country near the Black Sea. It has a very, very rich past, rich culture. The population-wise, it's very small. If you compare it to India, we have only 35 lakhs, you say, of population. That's the two districts of New Delhi. But still, it's a very big center of culture from the ancient times, and we have big tradition of education since the Middle Ages. And the University of Georgia is the biggest international university in our country, has the highest number of international students and the widest range of English programs.
Okay. When does the clinical rotation starts?
Most of the clinical rotation starts when the person is on the fourth year. From the fourth year, every semester more and more rotations come for the student because we have this approach, first 3 years of more theoretical subjects, you have the simulation hospitals, you have the OSCE examinations, you have the digital anatomy classes, so everything is preparing you to be really, really ready for the hospital experience, then you go for the hospital.
Okay. And one more thing, most important question, when will the class start this year?
This year, in October.
In October.
Yeah. We have two intakes. One intake is the fall intake, the other one is the spring intake. The spring intake usually starts in the early March. We have two resumption dates, around 10th of March and 10th of April. So for those who will be late for visa, they'll come on 10th of April. Same two resumption dates for the fall semester as well, around 1st of October, 1st of November.
Okay. And what about USMLE, PLAB exam coachings and all?
Yeah, so we have this idea to prepare people for the future license examination because without the license there is no job for the medical doctor in the hospital. So we've aimed our program initially on the USMLE experience, the first 3 years of step 1, more theoretical subjects, the next 3 years of more practical of step 2. Same will be implemented in India next year, next one and next two. So the idea that we were aiming for when we made the program is now very useful. And that's why the students are usually well prepared for the step 1 after the 3rd year of studying. And after the 5th year, they're eligible already for the step 2, but usually they take after 6th, after graduation.
What about internships?
Yeah, the internships, we have around 27 hospitals affiliated to the University of Georgia. There are two big hospitals that we are shareholders in, and we are very proud of them. They are the best places for the students to make a very good internship, rotational classes as well, and they are very good experience for the students because we have the limit of 5 persons at one bed, which means that they have more time to spend with the patients, actually taking care of the patient, actually giving treatment. And the professor also has a lot of time to spend with them, give the assessment, give some kind of recommendations, and it helps a lot.
Okay, so after 6 years, they can directly go for next or USMLE or PLAB, or else they can work there.
Yeah, because they have the degree of MD, which is already eligible for all the license examination in the world. So you just need to understand what kind of future perspective you want for yourself. You have to plan it for yourself, and according to that, you have to come back to India, maybe do next one, next year. You have to go to USA to do the USMLE step 1, step 2, or maybe in UK to do the PLAB. That's it.
Thank you for your time. Nice to meet you.
Welcome, welcome. Nice to see you.